The National Senior Citizens Center, NSCC, says it has developed a standard benchmark and curriculum for training caregivers to older persons in Nigeria. Dr. Omokaru, the Director General of the center, disclosed this during a stakeholders meeting on the validation of a draft national benchmark statement and minimum standards curriculum for training caregivers to older persons in Abuja. The DG further explained that the mandate of the stakeholders' engagement was to ensure a comprehensive framework towards universal health coverage for the older persons.
The takeaway from this meeting is that we already have produced a draft. The draft benchmark standards curriculum for training caregivers, and then draft guidelines classifying care settings, and also classifying certification of agencies. Those are the criteria, the standards for certifying, and then also recognizing the training providers. Is a standard. How do you assess? What we are taking away is that NSCC with its partners, you've seen all the consultants, you've seen all the professionals, you've seen nobody's left out. You've seen the MDs, everybody having a role to play. The takeaway at the end of it is that we should be able to produce a global standard document that will emphasize skills and competency in care of older persons, and that can stand up to the best practice, and then put in place, mechanisms for assess the trainers, you assess the training centers, you assess, how you evaluate, So it's a whole industry mechanism that we are putting in place, and we should be able to move forward with these trends. We have called in partners to ensure that we bring a benchmark standards in curriculum for caregivers and guidelines to standardize and certify care agencies, facilities, and operators. What this is opening up is that now the health insurance agency can now work with NSCC to see the different products that are available, and then we see which ones that we can align to, for instance, community care, to, for instance, care in these residential facilities, and to care within communities. This has never happened before in Nigeria. So we are working with NBTE first to classify this care, classify the setting, classify the skills, and then to ensure that these skills are recognized, and to ensure that there's a framework for progression, and then there's also compensation.
The Permanent Secretary, Federal Ministry of Humanitarian Affairs, Dr. Sani Guazo, represented by Mr. Joseph Dugwe, commended the center on its determination to improve the quality of health of older persons in the country.
The federal government is committed, through the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, to strategize for the full realization of achieving Agenda 2030 for Sustainable Development Goals, which has set out a universal plan of action to achieve sustainable development in a balanced manner and seek to realize the human rights of all people. This calls for leaving no one behind, for ensuring that the Sustainable Development Goals are met for all segments of society, with a particular focus on the most vulnerable groups, including older persons.